Now let's have a look at the NHS's handling of this pandemic. It's pretty clear that those working in the NHS have been truly heroic, working long hours under, at times, unimaginable pressure and awful conditions. And there isn't a moment on this show when I don't salute the amazing hard work of doctors and nurses and everybody in the NHS for what they have done. However, it's also healthy to debate the performance of the NHS in relation to other health services around the world. Enter, stage left, a new report from the Institute of Economic Affairs, who say that the NHS has been nothing special during the pandemic, and it does not deserve adulation as it has not helped Britain cope any better than countries with less well-funded health platforms. Let's speak to Dr. Kristian Niemietz, Head of Political Economy at the IEA. Hi, Kristian.
Hello.
I think we can agree that this is not an attack on the individuals working in the NHS.
No, obviously not. And if I had made a similar argument about in any other policy area, then nobody would understand it in such a way. If somebody talked about how educational outcomes, schooling outcomes are behind those of, let's say, Sweden or Finland, nobody would say, why are you attacking teachers or why are you attacking teaching systems? That would be self-evidently absurd. It's only when you talk about healthcare that some people pretend to misunderstand it that way. I don't believe that anyone genuinely misunderstands.
People on the internet deciding to interpret something in a narrow way that suits their opinions? Never. Now, Kristian.
Stranger things have happened.
Exactly. Tell us what the headlines are from this report then.
Well, I mean, the report is mostly about the fact that a lot of people have used the pandemic as an excuse to peddle their old agendas. You can see people from across the ideological spectrum saying, oh, this proves that whatever I've been saying over the past couple of years, whatever my pet cause has been right all along. I've been right all along. I've been vindicated. And in a lot of cases, this is harmless agenda peddling. But there are a couple of more severe cases where we could really learn the wrong lessons. And one of them would be if we draw the conclusion that we have to rally even more around the NHS and shield it even more than ever before from criticism, because if we look around, there's no reason to believe that the NHS has performed any better than other healthcare systems. I mean, we have the second or third highest excess mortality rate in the world, and that's pretty grim.
Indeed so, and clearly bed capacity, particularly capacity of intensive care units, has been below that of similar Western nations like Sweden and Germany.
Yes, I mean, in the German case, you could say, okay, their healthcare system is better resourced, better funded. They spend more money on it. But in total, healthcare spending in Britain is pretty normal, pretty average for an OECD country. We spend just over 10% of GDP on healthcare. And that was before COVID. Obviously, right now, the numbers are all over the place. But in 2019, that was the figure. And that's perfectly average. Yes, some countries spend a bit more, some spend a bit less, but there's no reason to believe that the NHS is specifically underfunded.
And your argument in this report is that it's not all about money, but rather excellent management of a health crisis. So can you cite examples of lesser funded health models that performed as well as the NHS, if not better?
That's certainly true of the best performers, which are the Asian countries, Hong Kong, Taiwan, Singapore, and South Korea. Although there, I wouldn't specifically say that must be because of the healthcare systems, because that has a lot to do with the overall governmental response. They also imposed travel bans early on and were just generally took it very seriously right from the start, when we still had this attitude, well, it's a bit of a flu, let's not panic about it. But healthcare systems must have played a role, in at least insofar as other countries got up mass testing far quicker, whereas here we were, and this is not just in comparison to Asia, but also with most of the neighbor countries, that throughout March and April, there wasn't much happening here in terms of COVID testing. We only really caught up with the neighbor countries when we were already past the peak of the first wave.
Indeed. And also one of the reasons why cases and the tragic COVID death toll is lower in parts of East Asia, including in Vietnam, is because public health is better. There is less obesity. So that should be considered part of the responsibility of the National Health Service, is the fact that Britain, pre-pandemic, was the sick man of Europe.
Okay, there I wouldn't specifically blame the healthcare system. That is mostly about lifestyle, and from what I've seen, it's not really clear whether that really is a major risk factor. There is some weak evidence that it might be a marginal factor.
We know, Kristian, that
help.
obesity is a major factor in whether or not COVID will kill you.
Well, it doesn't help, sure. But even obesity rates are not that unusual in Britain. So I wouldn't put this down specifically to lifestyles. Maybe when you make a comparison with Asia, okay, that could be a factor. But in comparison with the continent or North America, then there's nothing that unusual about obesity rates here.
And finally, your prescription, no pun intended, Kristian, for an NHS going forward that is fit for purpose, particularly, God forbid, if there's another pandemic?
Okay, in this particular report, I'm deliberately not making recommendations because I'm accusing everyone else of peddling their agenda.
You should go into politics, Kristian.
Yeah, maybe. No, I think I've burned.
Just complain about
already.
Everything, but offer no solution.
Yeah, I've done that elsewhere. I wrote a short book on health reform 5 years ago, Universal Healthcare Without the NHS, in which I'm saying, ideally, we would adopt a social health insurance system of the type that they have in the Netherlands and Switzerland, where they have better outcomes across the board. Everybody has private insurance. If you can't afford your premiums, then the government would pay them for you. There's no discrimination against people in bad health, so everybody is covered, and you still get a competitive market.
But
so
the
you
problem
get the best of both worlds.
The problem you have, Kristian, is that word private. That sends fear and shivers down the spine of every politician in this country. The NHS is one of the crown jewels, and any idea of privatization by the back door is just not going to fly.
Well, that's why I'm not going to be a politician. I prefer the ivory tower of the think tank world.
But it's a very, very valuable and important report, Kristian, and something I'm very passionate about is two things, really, which is, A, the fact that I love our NHS, and it's one of the great institutions of our country, but I'm also passionate that we must debate whether it works and what parts need to be changed. And I think it's okay to have that conversation. The problem you have is that at the moment, in the current climate, you will be burned at the stake for daring to whisper a syllable of criticism. And frankly, if we can't, isn't it? If we can't criticize the NHS, it can't change and it can't get better.
Yes, that's right. Yes, it's the sacralization.
Yes, brilliant piece. Excellent report. And you can read about it across the papers today and tomorrow. Kristian Niemietz is the Institute of Economic Affairs Head of Political Economy.